Hello everyone. This is the cardiovascular group giving an addendum to our rheumatic heart disease, which I will refer to as RHD. We had a 6-year-old, and unfortunately that's a pediatric case, and that is not part of this class, nor would it be part of our practice as a practitioner. So we advanced our 6-year-old to 36 years old. And she is presenting with several weeks of heart palpitations and increasing fatigue and shortness of breath. So we know from our previous presentation she had a case of pharyngitis, strep A, leading to acute rheumatic fever when she was around 6 years old. And it's unclear whether treatment was provided, and she doesn't have a good memory for her medical or surgical history. So we don't have anything that we can relate to back as far as how treatment went. She did have a previous history of asthma. She does currently still have a medication, albuterol inhaler. Socioeconomically, she has lived in orphanages and foster homes until she was 18 years of age, then was in adult foster homes until she was able to find good employment and housing. She is now working as an aide at social services and is attending college. We look at the symptoms of RHD as an adult, and she is coming in with a classic, the top 3 of RHD symptoms are increasing shortness of breath, fatigue, heart palpitations. Also could be pulmonary hypertension, heart failure, and systematic emboli that would be found under diagnostics. The symptoms of RHD depend on the valve lesion and its severity, so it depends on the patient. They might come in straight with heart failure, you never know. But we have to be able to link it back. So in general terms, early heart failure is your breathlessness on exertion, feeling tired, general weaknesses. And then as it progresses, the symptoms may develop include orthopnea, paroxysmal nocturnal dyspnea, and peripheral edema. Palpitations occur with AFib, and the arrhythmia is associated with increased thrombolytic risk, like stroke. So people that come in with aortic valve disease may experience angina and syncope. The clinical examination includes an assessment of the severity, meaning we need to decide where she's at as far as her heart failure, what complications, and any new murmurs that might be present. So early diagnosis is very important with RHD and their survival rate. So it's important secondary prophylaxis can be started as soon as possible to prevent the progression of valve disease. So we would do an echocardiogram, and that would diagnose and monitor the heart valves to detect any progression of the disease. And then the management of RHD is complex and requires careful coordination. The main goal is to prevent the disease progression and to avoid or at least delay valve surgery. It's ultimately most likely going to happen. However, you can delay it. Management of RHD depends on its severity, of course, and the need for surgery is determined by, there's like a grading system determined by the symptoms. The heart valves can be significantly damaged, the heart chamber is distorted, and cardiac function is significantly impaired. And in this case, she is 36 years old, and her EF is 40%. So that's low for a 36-year-old. She has mitral valve regurgitation with some stenosis and cardiomyopathy. So I'd say she's at the early stages, maybe even middle stages of heart failure. So we gave the physiology, pathology, and everything regarding how your heart gets to the point of having the lesions on the valve and things like that. So now I want to just kind of rewind and go back to how we get to the rheumatic heart disease diagnosis. It's a very important socioeconomic question. So our patient presents with palpitations and fatigue. Those are very common symptoms. Are you going to be able to say, oh, that's rheumatic heart disease? No, you're not. You're going to have to do some investigation. So we're going to dig a little deeper, and when the patient is presenting with symptoms, you ask about their childhood sickness, and you find out what their living environment was through their adulthood. You're going to find out that the majority of the cases are female, that come in with a new onset of symptoms of RHD are between the years of 20 to 39 years of age. I thought that was a good indication of where our patient is right now. People who have had a previous attack of rheumatic fever are at high risk for recurrent attack, which worsens the damage of the heart. So prevention of recurrent attacks of acute rheumatic fever is known as the secondary prevention. So we would involve regular administration of antibiotics that would be continued for many years. I've seen some studies say that they would have long-term antibiotics for 10 years. And I'm thinking the physiology behind that is because it's just not something you can just get rid of, until you replace the valve, I guess. Anyway, so the worst affected areas, of course, are not in the U.S. However, we do have some incidents, but the most worst affected areas is Africa. In the Pacific, the indigenous population of Australia, they've had a huge increase of RHD, and New Zealand. About 1% of all the school children in Africa, Asia, and Eastern Mediterranean regions in Latin America are showing signs of the disease. It's related to poor quality housing and overcrowding, and they are the major factors that keep this disease from being able to get rid of it. There is a lot of cost involved for valve surgery and long-term antibiotics, so the secondary prevention of monitoring and trying to prevent the progression of the disease is the main focus. So what do we want to take away from this? It is the patients aren't just going to come in and say, hey, I have RHD, I have fatigue, I have shortness of breath. It's going to be our job as a practitioner to stop. And our group encourage you to stop and investigate your patient prior to diagnosing them, understanding their symptoms and where they might have started. Their social and economical history, and most of all, the prevention of the disease progression of RHD is very important. I hope that gives a clearer explanation of the adult process of RHD. And if you have any questions, just let us know.